Hi, Sarah. My name is Brooklyn. I'm a level one nursing student. I'll be following you today. Can you give me a spelling your patient?
Oh, sure. Her name is, and I'm not real sure how to say her name, so I can ask her when we get inside, but it's Shanana O'Connor. She's in room 231. She's a full code. She's on a special renal disease diet, so she has an oral fluid restriction of 1,500 milliliters a day. She does have an allergy to trimethotropin sulfamethoxolate, which is a sulfonamide antibiotic. She's a 34-year-old woman with type 1 diabetes. She also has end-stage renal disease. She presented today into the emergency room at 5:30 with fever, chills, and malaise. She reports an increase in her blood glucose levels, a decrease in appetite, and that her usual doses of insulin haven't been working for her to lower that blood glucose. She also has minimal or less urine output than she's used to. She has a history of renal failure, which is secondary to her diabetic neuropathy and hypertensive nephrosclerosis. She's been receiving dialysis 3 times a week for the last year, and she is on a donor transplant list. She has a history of a graft infection, which was treated 3 months ago with antibiotics, and that seemed to work. She also has a history of recurrent UTI. Her vitals today, she has a temperature of 100.9, and that's what's indicative of that infection. Her blood pressure is 138/78. She has a heart rate of 108. Respiration's 20. Pulse ox is 97. Her blood glucose levels at 545 or 210. So right now we're waiting on CBC with a differential, a metabolic panel, and a culture and sensitivity on her urine. We did get our urine results back. The urine was cloudy and amber in color, but it was negative for leukocytes, ketones, and protein. Her skin is warm and intact. Her AB graft for the dialysis is clean, intact, and pink. She does currently have an IV in her right median vein. She's tachycardic with a regular rhythm plus one non-pitting edema. Her respirations are clear to auscultation in all lobes. Her abdomen is soft, not tender, no distension, with bowel sounds equal in all 4 quadrants, and normal range of motion in all joints, but her sensation is diminished in her lower legs due to some neuropathy. Um, so the plan right now is that we're going to continue, she is on that fluid restriction, so we're going to really pay attention to her INO and monitor that with every shift, her vitals every 4 hours. We're going to continue her normal dialysis regimen while she's here in the hospital, and of course get blood glucose levels before meals and at bedtime. Right now we're getting ready to go in to treat her for the infection. We're going to run some fluids and some antibiotics. She's going to get imipenem, 500 milligrams and 100 milliliters. We're going to do that over an hour with 9.9% normal saline.
Oh, very, very cool. Why specifically is this client receiving this medication?
It's to treat her infection, the increased pulse and the temperature.
Okay. And what action does this medication have on the body?
It's a broad spectrum antibiotic that works on gram-negative bacteria, and it works by destroying the cell wall.
When should you question administering this medication?
Well, this medication we would question if she had an allergy to any cephalosporins or penicillin. We do know that she does have an allergy to the sulfonamide, so we did want to double check that, and this would be appropriate in that case. You would also question it with someone with renal impairment when she does have, but she is a candidate for this medication because she's currently on dialysis. So that's kind of the mediator there, what allows her to have this medication.
Okay. Does this medication have a therapeutic serum level?
No.
What vital signs must be monitored?
Well, with her, in any case, we're going to monitor vitals every 4 hours, but specifically keep an eye on her temperature.
Which physiological parameters should be monitored when the medication is being administered?
Okay, so mostly labs really see CBCs, her liver functioning test, creatinine, and a BUN, which are indicative of renal function.
Okay. What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
Okay, so we're going to administer it's an IV medication. She just needs to be aware to report any adverse effects. If she's having any kind of swelling or irritation at the IV site, if she notices any signs of an allergic reaction, um, or if she's having a lot of gut irritation or diarrhea, that would be something that she'd want to report.
Okay. What interventions must be taught for taking this medication safely at home?
This would not be a medication that she would have at home. It's administered IV.
Okay. What are the side effects and potential adverse reactions?
Diarrhea, nausea, thrombophlebitis at the site of the IV, and then of course always want to watch for allergy anaphylaxis or super infection. By that I just mean that the bacteria get resistant. She can get some C. diff in the gut. So you do want to monitor for signs and symptoms of that, and diarrhea would be a key point.
How will you know the medication is effective?
Well, here we would ideally have the labs first, and then we could compare the culture and sensitivity and the white blood cell count to measurements done after the treatment. But since we don't have those to kind of go on, we want to just make sure that that temperature lowers, that the signs and symptoms that she has now are gone. So the temperature would turn to normal, and then the culture and sensitivity that we get back would be, indicative of no growth or overgrowth rather, and that her white blood cells were within range.
Okay, awesome. Thank you.
Sure, no problem. We're gonna go in now. Okay. Cool.
And
Hi.
hi.
And let's see. Ms. O'Connor, my name is Summer. I'm going to be your nurse today. I brought in a student with me just to kind of show her we're going to give you some antibiotics for the infection that you have going on right now. And how do I say your first name?
It's Shanae.
Shanae?
Shanae.
Oh, okay, wonderful. I was saying it wrong the whole time. I had no idea. All right, let's see. So we're going to go ahead and get you scanned, and let me just wash my hands quickly. And now here, Brooke, we're going to start. I just want to start, we're going to hang the IV fluids first. So we're going to start by scanning in the patient and then also the drug. And so, Shanae, can I have your first and last name and then your date of birth or your age rather?
It's Shanae O'Connor, and I'm 34 years old.
Okay, and do you have any drug allergies?
Yes, it's trimethoprim sulfamethoxazole.
Okay, let me go ahead and check that. And we see here, yes, that she does have that allergy, so that matches what we have in the MAR. Now I'm going to go ahead and scan her number in here. Oh, wrong number. Shanae, would you mind reading me that number underneath?
I have this.
Oh, just kidding. Okay,
Yours
then I'll
is
just do it
different.
myself.
I could be.
Okay.
842.
It's right here.
334. No.
Okay, gotcha. And then we're gonna scan in her bag of fluids here. I think I have to. Okay, awesome. So then when we get that right and we have everything scanned in, we know that we have it the right way because we can see a green light. And I don't know, if that's a little wonky.
Go. Yeah. I think
Woo.
you can see.
Okay. And if there was a glare, Brooke, can you see that there's a green light just to kind of
Yes.
identify for everybody?
It is a
Okay.
green light.
Awesome. So let me go ahead. Before I hang this, I want to get some gloves on and my hands again. So before we actually hang the meds, I have it scanned in, but I want to check for the expiration date. I want to check that there's no tears in the bag. It's not compromised in any way and that it's clear. By scanning it in and getting the green light, I know I have the right patient and I have the right bag of fluids here. So I can go ahead. Now, I go ahead and say that, but before I spike the bag, get that going, I want to have be able to hook it up to Shanae. So first I want to flush that line and just make sure that it's patent and there's no swelling, irritation, or redness. Alright, darling. And can you give me your name and your date of birth again?
Shanae O'Connor, and I'm 34 years old.
Okay, excellent, Shanae. Thank you, darling. And I'm just going to scrub that hook for 15 seconds. Alright, and the site looks good. There's no redness or irritation. And does that hurt? How does your IV site feel?
It's just fine.
Okay,
it's not
cool.
hurting at all.
Right on. And then I'll just go ahead and leave that. I'm going to open up my tubing here. Now we don't have a pump, so we're using this thing called a Dialaflow, which is attached to our bag. And I just want to go ahead, for safety, turn it to the off position. Oh, goodness. And that's going to ensure that I don't have anything there. Ooh. Okay. Now when I spike my bag, it's just sterile to sterile, so I want to be mindful that I don't touch that white spike, which I did not. And we're good, and my Dialaflow is off. I want to fill the chamber about halfway. Okay, wonderful. And this is a really long line. But as I turn the Dialaflow and open it, all right, we're cruising. Gotcha. Okay, we just want to make sure that all those little bubbles are out of there. Perfect. Alright, and then I'm just going to turn that off. I'm going to disconnect my flush. I just left it on there. And now just connect that to the end of my line. And her fluids, because she is on that liquid restriction, are going to be really going slow. We're just going to keep that at 30 mils an hour. Okay, that looks really good. Ooh, don't drop your IV, Shanae. Just kidding, you never drop your IV.
No, of course not.
All right, and now we're gonna do the same thing that we did for the antibiotic. Yeah, it's 30 mLs. It's like a little bit. It's not going very fast at all. Okay, with the antibiotic expiration date, check the bag. It's not broken, torn, ripped. There's nothing floating in it or weird. It's the color that it should be. With this drug, I do want to double check the reference and make sure that the dosage is correct. She does have renal impairment. She does have allergies to other antibiotics. So when I do check the reference, because she's on dialysis, this is a safe drug for her to have, and it is not. It's indicated with allergies to penicillins and cephalosporins, not with the sulfonamides that she is in fact allergic to. So she's good to go. Okay. Now I'm going to do the independent. Same thing, and oh my goodness, I'm so sorry to do this to you, darling. What's your name and date of birth? One more time.
It's Shanae O'Connor, and I'm 34.
Okay, gotcha. Okay, and then the skin medication. Okay, gotcha. And then on this one, again, we have the green light, and that does indicate to us that we have the right medication for the right patient, and that it's the right time and the dose. And of course, we check all that against the reference as well. So on this, we've already got the line running at 30 mLs. I want to drop my primary bag lower, and you're going to do that whenever you have a piggyback. So let me just and then my secondary here, same thing. Sterile to sterile. Definitely want to make sure I have the clamp on this. There we go. Perfect. Scrub the hub on my primary. Oh, you know what? This isn't gonna work at all. I'm gonna go ahead and stop this dial flow, because if I pick that up, then we'll have that going into her. Okay. Go ahead and turn that off first. Okay, perfect. Now we know that's not going to go anywhere. Plug that into the secondary. Set this to the right amount. And for this, she's going to get, it's in 100 milliliters, and she's going to do that over an hour. So we're going to set this to 100. I'm going to open the clamp here. We want to be mindful, since you can't have too many fluids, that after an hour we're going to come back in here, take this, get rid of the piggyback, and then set it back to 30, so she's not running fluids at 100 mLs because of that little dial flow guy. Okay, and okay, Shanana, you are all set. You've got those going. Now I do want you to call me if you have any irritation or redness or swelling. If that site feels uncomfortable, please use your call light. Let me know. Let me know if you get any numbness, any tingling, any itching, any sign of allergy too. That's another thing that you want to let me know about. Let's see, I'm going to go ahead, and you've got your call light. It's right here. Your bed is lowered. When are you going to give me a call? What kind of symptoms would you have?
Oh, if I have any redness or anything bothering me with the IV, or having kind of itchiness or tingling,
Okay,
something like allergic reaction.
perfect. Thank you. Give me a call if you need
Okay,
anything.
thank you.
Great.
I just have a couple more questions.
Sure, Brooklyn.
Were there any pertinent pieces of information you reviewed before administering the client's medication?
Yeah, there were. We wanted to, of course, check the med guide to make sure that that was safe with her allergies. We also wanted to check the dosages with her renal failure, and then we also just wanted to make sure that the IV site was patent, and that it was okay to do that.
Okay. Did this information affect your decision to administer the medication?
Yes, it did. If she was allergic, the doctor would have had to definitely get another antibiotic. If she was not on hemodialysis, this would not have been an okay medication for her to have either. And then also, I did it in there, I just didn't vocalize it to you. We documented where her IV site was, the state of the IV site, and the medications that we gave.
Okay.
Yeah.
Did this information affect how you administer the medication?
This is a medication that is only given IV. So that was the order, and then that's kind of what we went with. We would have had to have chosen another site or redone our IV if she had one kind of infiltration or swelling situation going on there. Okay.
Okay, thank you so much. That's
Cool.
all the questions I have.
Thank you.